Ensure the pad cable is fully connected to the Zoll monitor and the electrode pads, and that the connector is locked and free of tension. Expose and dry the chest. Remove or cut away clothing. When using a Zoll defibrillator with pads placed front and back, anterior-posterior, one pad should be placed on the patient's upper right torso, just below the clavicle. The other pad goes on the patient's back, to the left of the spine, below the scapula, and at heart level. Plug the EKG cable into the Zoll monitor and ensure the connector is completely inserted and secure. Verify each EKG electrode is positioned at its designated anatomical site. Verify the end tidal CO2 sampling line or sensor is securely connected to the Zoll monitor's end tidal CO2 input. Confirm the connector is fully engaged and the line is free of kinks or moisture. Install the appropriate end tidal CO2 interface onto the bag valve mask, mainstream sensor inline or side stream cannula adapter, and verify that capnography is enabled on the Zoll monitor. On the Zoll monitor, enable CO2's capnography. Select CO2 on the monitor or confirm the CO2 channel is active. Confirm mode is appropriate. Verify the SpO2 sensor cable is securely connected to the Zoll monitor's pulse oximetry port. Then affix the appropriate SpO2 probe to the patient, finger, toe, or earlobe. Ensure intimate electrode skin contact and confirm a stable and steady pleth trace and valid SpO2 reading. Verify the non-invasive blood pressure cable is securely connected to the Zoll monitor. Select the appropriate cuff size. Apply the cuff to the patient's upper arm with the artery marker aligned over the brachial artery and confirm the connection before initiating measurements. Turn the knob to the defib setting. Press the arrow up button to increase the joules and the arrow down button to decrease the joules.